Hi there, welcome. This is Casey. In today's video, we will be discussing the medulla oblongata. And so we will be taking a look at some of the anatomy and physiology, as well as a bit of pathology related to the medulla. And we're also going to be exploring the medulla through the lens of iridology. And that will include the medulla brain zone and all that it encompasses, including the location of the medulla in the iris, as well as different iris signs and features that may be observed indicating varying levels of health. And I will also be drawing some connections between the medulla and some of the vital organs and organ systems that it governs. In addition, we will be exploring some natural healing methods, and one of those will include botanical medicine. So we're going to take a look at a handful of plants that are considered nervines. And nervines are herbs that are geared towards the brain and nervous system. And in addition, we will speak to some detoxification protocol for the medulla and the brain. And I also want to give you my perspective on a few healing modalities, including cranial sacral, massage therapy, chiropractic, etc., as well as some self-healing techniques that can be beneficial to the medulla. And then towards the end of the video, and probably this will be a two-part series. So in the second part, I will take a look at the energetic principles or the energy anatomy of the medulla, what chakra it is related to, and so forth. All right, and so before we get started, thank you so much for being here. Thank you for your comments and for your thumbs ups. If you are interested in a reading with me or a one-on-one mentorship, all of my info is in the description box. All right, so let's begin with the anatomy or the structure of the medulla. And so you can see it is formally named the medulla oblongata, although most often simply referred to as the medulla. There are, however, other medullas within the body, and the word medulla comes from the word medius or middle, and it means innermost or central. In this case, part of a structure such as the brain or glands. And you could also liken the word medulla to marrow, as in bone marrow. And so there is a medulla in each of the kidneys, the adrenal glands, and the ovaries. And then oblongata means to be made long. So we have the medulla here, and you can see from its location, you can interpret somewhat its role in the body. So it does serve as a bridge or gateway, or even a gatekeeper between the brain and body, or the mind and body, if you will. And it is the most inferior portion of the brainstem. And so we have the brain stem here, the medulla being at the bottom, the pons being above that, and then the midbrain above that. And the medulla is the portion of the brainstem that is attached and even continuous with the cervical vertebrae. And the atlas here, you may recognize the name of. This is the first cervical vertebra. And the atlas is named after the figure in Greek mythology who was made to bear the weight of the heavens. And so likewise, the atlas in the human body is made to bear the weight of the head. And the atlas is significant here not only in its relationship to and connection with the medulla, as well it is responsible for, along with the vertebra below it, the axis, the coordinated effort between the two vertebrae allow for the rotation of the head. And this is a specialized movement only occurring in these top two cervical vertebrae. So they allow for the head to turn to the left or the right, as well as allow for a nodding motion, so to look down towards one's chest. So what are some of the functions of the medulla? Well, there are several, and I like to think of the medulla as the conductor of the orchestra that is the body. It synchronizes and directs and orchestrates a multitude of functions related to the body's equilibrium and survival. And these include, but are not limited to, respiration, circulation, heart activity, blood vessel diameter and blood pressure, the diaphragm, and the oxidation of the blood, lungs, and tissues, as well as the reflexes of swallowing, hiccuping, sneezing, and coughing. And we have 4 pairs of cranial nerves, including the vagus nerve, that arise here in the medulla. And so let's go ahead and take a look at those nerves. And that will give us more insight into the functions or the physiology of the medulla. And so we can see that we have this area in here defining the medulla portion of the brainstem, and that we have the glossopharyngeal, the vagus, the accessory, and the hypoglossal nerves. And the glossopharyngeal is the 9th cranial nerve, and it is related to several functions of the mouth, including the production of saliva, the ability to taste and feel things inside of the mouth, throat sensation, swallowing, and the gag reflex. And then we have the vagus nerve, which is the 10th cranial nerve. And the vagus nerve is one of the most important nerves in the body. As well, it is the longest cranial nerve in the body. And it travels from the brain through the neck and into the chest and abdomen. And it affects several organ systems and regions of the body. And these include the tongue, pharynx, heart, and gastrointestinal system. And the vagus nerve is an essential component of the parasympathetic nervous system. So this is the portion of the nervous system that helps to regulate and reset the fight or flight response, in essence, calming the body. And the vagus nerve, as well as, I should say, the glossopharyngeal and the 3rd and 7th cranial nerves, which we're not going to go into today, are also involved in the parasympathetic response. And so the vagus nerve also regulates respiratory rate and some reflex actions like coughing, sneezing, swallowing, and vomiting. And then we have the 11th cranial nerve, which is the accessory nerve or set of nerves. And this nerve controls the muscles of the neck and upper back, assisting the head to turn and the shoulders to shrug. And then lastly, we have the hypoglossal, and this is the 12th cranial nerve. It controls tongue movement, making this nerve vital to speaking and swallowing. All right, so in terms of pathology, with all of this in mind, we may ask ourselves the question, what could possibly go wrong here? And the answer is anything and everything as it relates to the function of the medulla and these four cranial nerves. And so let's go ahead and take a look at another image. And this image gives us a visual of a term that you may hear associated with the medulla, and that is the decussation of the pyramids. And decussation means to cross over. And this, you can see this area right here in the medulla. This is the area in the body where most of our movement-related nerves crisscross. And this crisscrossing phenomenon is the reason that one side of the brain almost always controls the opposite side of the body. And likewise, this crossover of nerves is the reason that trauma here, whether it be caused through internal or external forces, quite often affects one side of the body or the other. And so distress in the medulla can manifest in a myriad of ways. And some of those would include partial paralysis of the opposite side of the body, loss of the sense of pain, touch, and sensation, loss of the sense of proprioception, or the sense of movement and position in space, partial paralysis of the tongue, loss of the gag reflex, difficulty swallowing, vertigo, dizziness, loss of coordination, headaches, migraines, and especially migraines with an aura, anxiety. One may also experience ragged respiration, high or low blood pressure, above or below normal heart rate, hiccuping, sneezing, coughing, salivation, and that can be in excess or the lack thereof, forgetfulness, or shallow breathing. All right, and then I want to show you another image, and this image shows us, of course, the medulla here, the pons above that, the midbrain above that, and we can see the pineal and pituitary glands, as well as the optic nerve, proximity to the hypothalamus. But the reason I would like to show you this image is because of this area in here, and this is the choroid plexus. And the choroid plexus is the area of the brain that secretes cerebrospinal fluid. And this is significant here because the medulla brain zone contains not only the medulla itself, it also contains the choroid plexus and as well as the cervical vertebrae. So I wanted to note that. And then one more. We have the foramen magnum, and I wanted to highlight this area of the body here. This is the occipital ridge, and it is the area at the back of the head. This is the occipital bone, and then the foramen magnum. So foramen means opening or hole, and then magnum means large or great. And so this is a large opening in the skull, and there are actually several foramen in the skull. And this one, however, is the largest, and it is the opening through which the medulla and spinal cord pass through. And you can see that, well, first of all, it's important, and you can palpate it yourself by tracing your fingers up your cervical spine, right up to the back of the head. You will find a hollow. And this is an area that is considered an endangerment site by physical therapists and the like. So massage therapy, cranial sacral Reiki, chiropractic, osteopathy. Anyone who is in the business of palpating the physical body, especially in this area, knows this is an area to be especially careful of. And it is also an area that gives one great access to the medulla and the cervical spine. So there are a lot of holds and techniques used by these same therapists to maneuver or manipulate the cervical spine or apply specific pressure in specific ways, even using energy work to work with this energy center and with the medulla itself. And so I wanted to show you this because we will touch on the energetic anatomy in the second video, but this shows you that this area, it is connected to, in terms of energy, it is its own portal, its own sacred place, absolutely, but is also associated very much with the third eye chakra, and it is also associated with the crown chakra. And so when we're speaking to the concept of Kundalini Shakti or Kundalini rising, we're looking at the spinal cord, and I will show you how that energy moves up the spine. But this is the last, being sort of like the final stop for energy. Kundalini, as it has traveled up the spine, this again serves as another gateway. So in the physical body as well as the energetic body, this area is a gateway. And so once the energy reaches this point, it is then sort of allowed into the third eye and the crown chakras. All right, so now let's take a look at a couple of animated images, and then we're going to move on to the iridology. And first we have the medulla and the brainstem. You can see that in green. So we're looking at the cranium or the skull, as well as, of course, the brain. And next we have the foramen magnum. And we can see the large opening at the base of the skull, through which, in red, you may note the medulla as it is continuous with the cervical spine, exiting the cranial cavity. And let's begin the iridology with the iris chart. And we can see right away that we have the head and brain area in both eyes between 11 and 1 o'clock. And this area comprises the brain zones. And it is above and outside of the transverse colon in both eyes. And while the brain zones may appear to be uniform, they actually do vary somewhat. And so I'm going to give you the coordinates for the medulla in both eyes. And we find it here in the left eye between 12.8 and 1.1. And so it does extend just slightly past the 1 o'clock. And then likewise in the right eye, it begins just before the 11 o'clock at 10.9 and extends to 11.2. And we may also note while we're looking at the location of the medulla that it is, like I said, all of the brain zones are outside of the transverse colon. So we have a direct correlation and connection to the transverse colon for all brain zones. And for the medulla, it actually, well, the medulla having many functions related to directing the processes of the digestive system. This is going to be a topic that we will continue to speak on, but specifically while we're here in the transverse colon area, I want to point out that In each eye, we have a flexure right at the medulla, and this is going to be significant. And so in the left eye, we have the splenic flexure right here. And the splenic flexure is also referred to as the left colic flexure, and it is the juncture between the transverse colon and the descending colon. And because it is a juncture or a turn or a curve in the road, if you will, we do tend to see a lot of accumulation of various waste and dysfunction in this area. And so we're going to see that the medulla is quite often affected by this flexure in the left eye, and then in the right eye, it is known as the hepatic flexure or the right colic flexure. And so we have here the transition between the ascending colon and the transverse colon. And so what we find here is quite often we're going to see radii solaris originating in the transverse colon, and even sometimes in the stomach area, actually quite often radiating into the medulla area. And so I want to bring up, well, first I will note that the splenic flexure is associated with various dysfunction. So like I said, we can have an accumulation of waste and dysfunction occurring here, and in the left eye with the splenic flexure, that is known as, quite often referred to as splenic flexure syndrome, and this is considered a subtype to IBS. And so we can also have an accumulation of gas in this area, and that will affect the whole entire digestive system, especially the colon. And I want to bring up the point or the fact that the science of iridology is far superior in this case, as is the case so often, in that in order to investigate or discern the health of a particular organ system, or structure of the body, we do not need to employ invasive testing methods. And so we have a lot of different testing methods, and it's coming to mind because I know with this syndrome in here, they can do anything between barium enemas to CT scans to MRIs to x-rays, and as well with the medulla when they're testing to find out exactly what the dysfunction is. And still, even when they do this testing, they're not actually able to, like we are in iridology, to find the origination point or the cause of the imbalance. But the medulla can also undergo various invasive and quite often toxic and even harmful testing to ascertain the health of this area. And we're speaking to the brain in this case, and then of course the colon, but I would think that we would want to avoid at all or most cost any kind of testing in the head and brain area. So I just wanted to mention that. And so we're seeing this very strong correlation to the transverse colon, and specifically to these flexure points and the medulla. And actually the medulla is probably one of the more common brain zones you will see come up, whether it's in your eyes or eyes that you are studying. And this may be due to the complication of this turn here in the flexures. But Bernard Jensen reported in his I've just read this in his Iridology volume 2, that over 80% of the cases that he examined, and that's thousands and thousands and thousands and thousands of cases in his lifetime. Jensen lived well into his 90s, so 80% of eyes that he examined showed lesions in the medulla area. So I wanted to mention that. And when we are able to see the cause or the origination, in this case it would be the transverse colon, or even we'll see some of the radii solaris, and we will look at some eyes originating in the stomach, that's going to give us clues and point us in the right direction for healing. And so that's going to include what kind of detox protocol and what kind of healing modalities we are going to employ. And in this case, when we're looking at the colon and the digestive system and the medulla, the first place we're going to go is to a colon or digestive cleanse. And so another feature of iridology being shown here is that not only does it give us the cause or source of imbalance or dysfunction, it also is, in doing so, providing us with clues related to our path, our healing journey, and restoring integrity and balance to the organ system, in this case, the medulla. All right, and so we're going to go around the iris, and I'm going to point out some of the features that are connected to the medulla. And so keep in mind, when we are looking, especially I feel at brain zones, but really anything in the iris, we're going to be looking for correspondences and opposites. And so we're going to be looking at, in this case, it will be the bladder zone, as well as reflex relationships. And because the medulla has so many functions, we will be exploring quite a lot of different areas in this case. And so I think we'll just go from right to left, and we will focus here in the left eye for now because we have the heart here. And in general, though, I want to say that there are going to be a variety of markings in the medulla, and these are going to be universal to the entire iris. So these signs may appear anywhere in the eye, and they're going to mean something similar in each area, but they will, however, be nuanced based on the area, if that makes sense. And so we're going to be seeing radii solaris, we're going to be seeing sora, we're going to be seeing lacunas, we're going to be seeing nerve rings, but they're all going to vary slightly in what they are indicating according to each area. So the most common thing that we're going to see in the medulla is a radii solaris, and I already covered that somewhat. They are going to originate in the stomach or in the transverse colon, and that's going to indicate distress in the digestive system. And in this case, it's actually pretty interesting because the medulla's functions related to the digestive system don't just include the colon. So it's also related to general digestive processes. So we have the intestines, the movement of the intestines, and enzymatic activity, secretion of gastric juices, and salivation as part of what the medulla governs. And so when we have a radii solaris here, we have toxicity radiating from this area of the digestive system and then causing an imbalance and adding stress to this area of the body. And what's happening here is it is a two-way street or a mutual relationship. And so when you have the toxicity radiating, whether it be through the circulatory system, the lymphatic system, into the medulla, it affects the function of the medulla, and then the medulla in turn is hindered in its ability to regulate the digestive process. And so I would say that the radii solaris is probably the most common, like I said, but it's also perhaps the most significant and consequential iris sign that we may see in this area. And another common sign seen in the medulla brain zone would be a lacuna, and lacunas are thought to be inherited iris signs indicating an inherited condition. And so depending on the nature of the lacuna, the color, shape, and size, that would give us further information. But yeah, so lacunas are also fairly common. And then we also may see psora or pigmentation or jewels in this area. And pigmentation generally indicates the presence of an accumulation of inorganic material, and that can be in the form of heavy metals, prescription drugs, any kind of toxicity or chemicals that we are exposed to either internally or externally can manifest as pigmentation. And in the case of the medulla, just like actually very common in the thyroid and the pineal gland, where we see a lot of calcification, we see the same in the medulla area. And actually, Bernard Jensen did mention that there was also a lot of calcification in the medulla area. And so quite often this is going to be caused by, it can be caused by procedures and substances used in the dental industry, as well as certain chemicals and other contaminants so often found in the water supply. And so another iris sign that you may see in this area, again, this is going to be a universal sign seen throughout the iris. However, it will have direct significance to the medulla, would be the presence of nerve rings. And so nerve rings are seen as indications that there has been a stress within or from without the body that has affected the nervous system. And so it is indicating distress within the nervous system, and specifically the autonomic nervous system. And because the medulla is so connected to the brain and nervous system, it contains the cranial nerves that we spoke to. It also contains both gray and white matter, so very much part of the brain tissue. And I didn't go into that or the reticular formation. Perhaps we will when we get into some of the other brain zones. But for now, we will just note that the presence of nerve rings in the medulla is going to be significant because of the autonomic nervous system as well as the central nervous system. All right, so now let's go ahead and go around the chart and note any kind of significant areas related to the medulla. And first we have of perhaps slight importance or relationship the neck and shoulder, as we have the accessory nerve controlling the movement of the neck and shoulder. And this actually brings me to a point that I wanted to mention, which is, in terms of looking at your eyes, you're not necessarily going to be, once you see the medulla brain zone come up, you won't necessarily then go searching for correspondences all throughout the iris, because the neck and shoulder can be simple stress or just basic tension found so commonly and so often in that area. But what you may do is just note if there are correspondences that seem to be important to you. And so neck and shoulder, perhaps, especially I would say if there is any kind of dysfunction related to movement. And then the heart, however, would be something that you may care to look for and make a note of. If you see a sign in the heart, you might want to check the medulla and vice versa. And so we see the heart here at 3 o'clock. And I do have one eye that has some iris signs in the heart area as well as the medulla, so we'll touch on that next. And we also want to be looking at the entire respiratory system, so the lungs, the pleura, the bronchioles, the left and right bronchus. So this is going to be, as we know, the lungs are bilateral in both eyes, so they're going to be over here at 9 o'clock in the right eye, 3 o'clock in the left. We're also going to be noting the diaphragm in both eyes and its role as the primary muscle related to the lungs and the oxidation of the lungs and the blood. And then traveling along, the bladder is of significance. It may be something that you look for. If you see the bladder, you may check the medulla and vice versa. The bladder is seen in iridology as radial, and radials are significant, especially when we are looking at the brain zones. So it is the area across from each brain zone. And so when you see the bladder medulla connection, you are going to note that there may be an insufficiency or imbalance or weakness in the bladder, and that can be related to medullary pressure. And then of some significance may be the spine. And why? Well, because of the two reasons. The lower, so we have the lumbar and thoracic spine found in this area in the right eye. And then we have the continuation of that, the cervical spine found in the medulla brain zone. As well, we have the choroid plexus, as mentioned, secreting cerebrospinal fluid. And then we may also see signs in the pharynx, any of these three, larynx or the tonsils. Now, the tonsils may be of significance here, as they are related to the medulla in terms of proximity, and the tonsils being a vital part of the lymphatic system, they would contribute immune protection as well as removing cellular waste. from the medulla. All right, and then tongue, mouth, lower jaw. The tongue and mouth for sure as it relates to speaking, and we just discussed this as one of the functions of one or more of the cranial nerves, and then as well as salivation. And then one other area that may be of significance would be in the skin and circulatory zones. And so this would be on the periphery of the iris. And because the skin and the circulatory system interact in so many ways, and because the oxygenation of the body is so tied in to the lungs and the blood, and as well as the medulla. All right, so that may be it for now. In the next video, we will take a look at some eyes and see how all of this information, all of these connections and correlations to the medulla may come into play. And we're also going to look at some detoxification and healing protocol, including some botanicals, and as well as the energetic anatomy of the medulla. All right, I am going to leave you with a quote from one of my favorite iridologists, Dorothy Hall, and then I will be back soon with part 2 of the medulla brain zone. Until then, bye. From Dorothy Hall, she says, "We shall begin our exploring of the head signs in the iris with the chairman of the board, the control panel of the power station, the conductor of the physical orchestra, the medulla. This soft bulb of brain tissue helps to set your IQ, your structure type, although indirectly, and the amount of physical control you have over this structure and its function. It is the physical message transmitter from the brain directly to the spinal nerves and their impulses to all coordinated body systems. You can see why it's our most obvious starting point. Car accidents with whiplash, kicks at the base of the skull in sporting contests or outside pubs, and hits over the head with blunt instruments can loosen the directness of this control and cause incoordination problems. Parkinson's disease often shows first in this area of the iris and later in the locomotor zone. If white signs show in the zone, you can expect a well-controlled individual physically, although maybe too tightly controlled, able to make the body do what the head tells it. If yellow or brown signs appear, there may be a fault in the control mechanism, which is only sending low power signals to the body. This kind of person lets the body rule the head. Inefficiency in the body can also reduce the high-powered signals from the medulla so that its messages do not get through as directly as they should. Chiropractic adjustment of the spine can often reactivate a sluggish medulla which has gotten tired of sending physical spinal impulses not correctly translated by the spinal nerve centers. Patients often feel an obvious surge of renewed energy to and from the head after adjustment of the cervical vertebrae stimulates the medulla. Structural lesions in the iris at this point can show a record of past physical trauma, or can merely show that you have pulled your head in under stress and that compression has resulted. A good stretch of the neck each evening before bed can take the weight of your tired skull away from your physical major control center and let it rest too. Directly across the iris on a reflex diameter lies the bladder zone. Children who wet the bed long past infancy may have medullary pressure or insufficiency to blame for their misery. Their non-control of the bladder is a symptom of this medullary imbalance. Not a psychosomatic problem, but a real physical one in this case. Many natural therapies treat the control center for such problems. The medulla controls some intellectual and emotional processes, but its major job is to synchronize, coordinate, and transmit down the spine signals to and from the brain, dealing with physical happenings.